everyone to our town hall today. We'll be talking about COVID-19 going from a pandemic to an endemic disease. Without further ado, I'm going to pass it over to our state school nurse consultant, Caitlin Costes, and she's going to introduce our speaker.
Hi, everyone. Today we have Dr. Mark Levine, the Commissioner of Health for Vermont, who has worked tirelessly for the last 2+ years on the COVID-19 response. And today he will be talking with us about the transition of COVID-19 from a pandemic to an endemic disease in Vermont. So I pass it on to you, Dr. Levine.
Thank you very much, Caitlin. Hopefully to the relief of everyone on this meeting, I will not be using slides today. I'll be referring to a number of comments I've jotted down about things I wanted to cover with you, but I certainly want to allow for time for questions as well. So I will not just talk the entire time. I've been asked to cover a couple of things. First of all, the transition to endemicity, which I have to be frank is a term I'm becoming less fond of with each passing day, but I will negotiate that with you. I'll talk a little bit about how I see things going in the future in terms of us and the virus. And I've been also asked to talk about what the practice of being a school nurse will look like going into the future with COVID doing whatever it chooses to do next. So I will touch on that as well, and hopefully be able to sound like I know what I'm talking about, but actually, as I've tried to tell the public lately, you ask anybody to predict anything about this virus, and the answer they should always give you is, we have no idea, because that's really the truth. Think about the number of curveballs we've seen in the 2 years. Think about the fact that now we're in the BA2 part of Omicron when we thought Omicron was over, et cetera, et cetera, et cetera. You're not even seeing a lot of modeling and projections going on from CDC and others. A lot of educated guesses, which I am a complete proponent of and try to label what I say as educated guesses, but that's kind of where we are. But I will talk about your future as much as I can. So let's start for the moment with this endemic kind of thing. So we're in the Omicron phase of the pandemic. We all know Omicron is the most transmissible variant we've seen to date. We're now in the subvariant BA2 part. And today we just heard that New York State has subvariants of BA2, BA2.112 and another one. So there's probably no difference in all of the BA2s, except that they are even more transmissible than the original Omicron, BA1. They are also continuing to show less severity of illness, or at least they are not more virulent than what has come before. They are also showing opportunities to evade the vaccine when it comes to the ability of someone to get infected. But if someone is appropriately vaccinated and boosted, meaning our definition of up to date, the vaccines are working wondrously with regard to the ability of someone to stay out of the hospital, out of the ICU, out of the morgue. And this is really important. Now, we only had smaller number of kids in those categories that I just mentioned from the beginning of the pandemic till now. We think we're still seeing lessening in that population as well. But obviously, when you're starting with a very small number of kids across the country who get hospitalized or have a severe outcome beyond that, it's going to be even harder during a time when there's more and more cases to get a handle on that right away. But so far, for adults and kids, it really does seem like that's what we're encountering. I always say that even with lower virulence, it doesn't mean that we're not going to see more cases of people having bad outcomes just because there are more cases, period. So it's a small percentage of a large number still turns out to be a lot of people. So I give you that caveat. But the reality is, at least on the pediatric front, Dr. Bell hasn't seen a COVID admission since February. And that's good news. There are plenty of other respiratory viruses that are still affecting kids and adults, though. Obviously, just because something is less virulent, it still has a huge disruptive impact on everyone's life. And that's exactly what we're seeing. And I know many of you are seeing in your schools levels of cases that you hadn't seen for a while. And that obviously means huge disruptions for the student, for the class, for the parents who may have to stay home from work, et cetera, et cetera, et cetera. Never mind what it might be doing in the general population with regard to work sites and things of that sort. People very early on, when Omicron first became apparent, raised the issue of endemicity and said, well, this is just going to hasten our trajectory to get us there faster. And indeed, I believe that's what we've seen, and that's going to happen even more with BA2, a further hastening. So many people got Omicron in that initial peak. So many people got Omicron that didn't know they got Omicron in the initial peak because many of their symptoms were very mild or not present at all. And the reality is, the rapidity of the way this passes through the population has to get you to an endemic state, if you will. Looking at where we are now in April, we basically have a less of a handle on how many cases there are just by using the kind of state data that we talk about. We have a better handle using experiences like, who do you know who has COVID right now? Well, suddenly people know people who have had COVID or have it currently. School nurses know how many people in classes are not in class now because of COVID. And so that reality is becoming self-evident. The good news is that we know that a rapidly transmissible virus seems to pass through the population quickly enough that it decays off fairly quickly. We're seeing that in places around the world, and we're seeing that in places in this country, but it's obviously not happened here in the Northeast just yet. We also know that climate change, and this is a favorable climate change, is occurring. It's becoming spring. There'll be less gathering indoors, more time outside, more windows open, et cetera, et cetera. So that should help us a lot as well. And of course, we know masks got removed in terms of requirements, which is going to have an impact in the other direction to some degree, but not necessarily to a stronger degree as you might imagine. The big thing about where we are now on the way to endemic is what's being termed decoupling. There's a decoupling of cases with severe outcomes. And that's why if you hear public figures, whether they be local or national or international, talk in a little bit different way, it's in recognition of that fact. Now, some of it sounds rather caustic or not really showing humanity, because you'll hear things like, look, people are going to get this, and that just is going to happen no matter what we do, and we can't possibly interrupt that. Well, of course we can interrupt that. We can put masks on everybody. We can separate everybody. We can tell them to stay home and stay safe like they did in the very first week of the pandemic. I don't know how many people you know that want that to happen again, but that could happen. And we would suppress the level of virus, I think, quite effectively if everybody stayed home from work and school and didn't go out and didn't interact or gather. But you're not going to see that happen again in our population unless some very serious variant comes about that puts everybody in high risk of dying or getting so sick that they're hospitalized. So when people like even Dr. Fauci have said, it's not a matter of if, it's a matter of when, that's the truth. Because as we know, highly effective vaccines are still allowing people to catch the virus. Hopefully, most of the people you know are like the people I know that are getting head colds and not getting severe illness, unlike anything they've had before. For the majority, hopefully, that's what's happening. And that's happening in the adult and kid population. Now, to move to the word endemic, the definition I like to use is one that's fairly simplistic. It's a disease that's constantly present to a greater or lesser extent in a particular place over time. Similar to sort of saying, this is another annoying common cold. Something like the flu, perhaps, where we don't think about a season that isn't going to have flu, though we actually had one during the pandemic because of our behaviors. But most of the time we think of like, well, if life is going to go on, we have to learn how to live with the flu. And so that's what endemic means when it comes to COVID. What we do know is that through both people getting natural immunity because of they've gotten the virus and vaccine-mediated immunity, we're going to have a high proportion of the population have immunity. The reality is we had such a naive population, a disease-naive population through most of the pandemic for at least a year plus, that people in Vermont are still getting newly exposed to this virus because it just wasn't around before Delta at the levels that it's become here and around the country. We really were an island, and that was very effective for a long time. But now when you've got variants that are this transmissible, it's impossible. So there'll be a high level of immunity acquired one way or another. And keep in mind, the best level of protection is probably from the combination of having had an infection that hopefully wasn't serious and having yourself up to date on vaccination when we look at the studies about the level of protection you have against a variety of outcomes. The implication of endemic means less volatility, less surge kind of environment in the future. So that huge Omicron peak that we saw in the beginning, that should be less likely to happen. And with BA2, it should be a higher plateau, but not a surge that goes up in that direction. And whether this will be a seasonal virus or not, I have no idea. It hasn't behaved that way to date, but because it is a respiratory virus, I think once we as humans have shown that we've now had connection to it, it will start to behave more like a respiratory virus and hopefully become more seasonally directed. But we shall see as the spring and summer go on here. This has big implications for boosters and when you should get them, what they should be, etc. The implications are also tempered by understanding what's going on in the rest of the US and the rest of the world. Many of you have heard me say that the bottom line for our future is the vaccination rate. So we in Vermont continue to lead the nation. The Northeast continues to lead the nation. That's wonderful. But we know if you go to the very southern part of our country and other places in the Midwest, the vaccination rates are literally less than half of what we have in our state. That, along with countries in the world, particularly in Africa, where there are rates well under 20% for the entire population of a country on that continent. That's the substrate for more and more variant development and potential variants that we don't want to see because of the characteristics they may have. So we can do what we can do here in Vermont, but I think we are a global society, and we've already learned how quickly Omicron spread from South Africa to Europe to here. That's our future. And the goal is to really have vaccine equity and not make access to vaccines, financial issues, and misinformation lead to the next tragedy when it comes to the COVID pandemic. So having said all of that, here's how I see some of the future. We'll have high level of immunity, as I just mentioned. I cannot imagine having no new variants, and Omicron being the last one. We've seen how this virus easily develops new variants, even variants of subvariants all the time. So I think that's going to continue. We're going to have a world that we live in, a society that does merge this reliance on individual decision-making, which we've stressed here, personal risk assessment, personal risk tolerance, and a huge wave of new ethic of stay home if sick. I, like many of you, have read the 7 Days article that a number of you appeared in, and that was just right on. Congratulations to everyone who participated in that, because the school environment has to be a stay home if sick environment to be the safest it's going to be. I think some of you have already seen some of that slipping, even though it was in everybody's toolbox and toolkit right up to recently. We have to make sure that can't slip again. That may precipitate a whole host of other initiatives like family leave issues, parental leave issues, the kinds of things that people say are prohibiting them from letting their kids stay home and from allowing them to stay home with them, childcare issues. These are things that the pandemic put at the forefront, and justifiably so, and they need to stay there if we need to get this massive societal behavior change in place. And that goes not just for obviously school-age kids, but it goes for people at work, etc. But we're going to have that be our fundamental precept for sure, along with the individual responsibility and decision-making and risk assessment. Mix that in with having adequate at-home testing capacity, which will further evolve, because I'm a little uncomfortable hearing too many people tell me that their first several antigen tests were negative, and it took 3 or 4 to find a positive, or then they went to get a PCR and it was positive. The whole goal of at-home testing is learn it rapidly and act rapidly. So that needs to evolve further, but that's the right theme. Therapeutics is the right theme. We've proven that we have safe therapeutics. They're not as available as they need to be, but we haven't yet in Vermont had to deny somebody something. And these will evolve as in terms of availability and access, but also in terms of future development of further therapies that may be more user-friendly. Same for vaccine. Safety is, I think, a given at this point. Availability and access is a given, but clearly the constitution of the vaccine needs to evolve and will evolve. And we can't have a policy of every 3 months ask you to get a booster. That doesn't get us anywhere. Talk about pandemic fatigue. We're going to have booster fatigue. I think we have it already. So we have to have a different strategy than that and have more rational intervals between boosters, because they're more effective at doing what we want them to do. So stay tuned for that. Some of that's going to hinge on this $10 billion that Congress is supposed to be approving. regarding development of vaccines, therapeutics, etc., and allowing us to continue to fight the virus into the near future. And then there's going to be issues like masking. And how much does that become a societal norm or not? Well, people were really happy to take off the mask as quick as they could. Again, we have a subset of the population that has chosen not to do that. They need to be respected. They need to be treated civilly. They need to have the ability to make personal choice without question. And others need to not only respect those choices, but think about themselves at times, whether they're basing their decisions on events that they want to attend, what they want to do in their future, what the CDC community level is in their community or in the state, etc. So there'll be a lot of that kind of going on. As we get into this endemic kind of future, we're also going to have so many things to attend to that COVID brought to light, made worse, created, or left us with, but really, really are critical for us to be focused on. So I've talked about the concept of health debt. Health debt is that accumulation of adverse health behaviors, lifestyle behaviors that are leading to new diagnoses or exacerbations of chronic diseases relatively quickly, I might add. And those are going to really be impactful. They're already the reason why the hospitals were filled up through Delta and early Omicron was not the COVID cases, it was these medically ill patients, some of whom had COVID, but many of whom just got really sick. And that's happening all the time now. People are seeing more sick people. Nutrition, physical activity, substance misuse, all those kinds of health conscious behaviors went down the tubes for many during the pandemic. I do a little teaching still, and the students presented a case to me today, and the individual in the case had literally gone from obese to morbidly obese over 2 years with a weight increase of 200 pounds. Now that's an extreme example, but talk to anybody and you'll hear about, we talked about the freshman 15 or whatever when you went to college. Well, now people are going to have the COVID whatever number that represents what happened to them during the pandemic. I won't go into great detail on chronic disease, mental health, substance use, but you know all the key issues, and they're really, really important ones for us to focus on. Now, moving to the other topic of what's school nursing going to look like in the future. I hope you feel that one of the silver linings of the pandemic has been your role and the leadership you've been able to show, and the fact that the communities realize how important your role is, where they may not have actually thought about it much before. Just like any other healthcare facility, your healthcare facility and your focus in the schools has really contributed substantially to well-being in the communities that you represent. So I don't think you should have trouble being at the leadership table anymore if you've felt left out at times in the past, but continuing to advocate for that, go for it, because that's really, really important. If I look a little bit at the 7 Days article, at many emails I've gotten recently, at discussions I've had with pediatric colleagues, what I'm hearing is, in some ways, even though we're in the BA2 and it's distracting us, we're in the days of old right now. Kids are coming to the nurse's office with ear pain, with respiratory and fever symptoms that aren't COVID, with the GI illness that's been going around. And hopefully, God forbid, they're coming with some of their mental health trauma that this last couple of years has produced, and the stress and anxiety and depression and what have you that's represented in that catch-all as well, because that's what's happening now. So though we're thinking about what's the nurse look like in the future, you're back to the past in some ways because of just the fact that normal illnesses are happening the way they used to happen. And that's not a bad thing, to be able to focus on all of the old plus COVID, as long as COVID isn't a gorilla, an elephant in the room that is overwhelming everything else. And as I mentioned earlier, these other illnesses are the causes of more hospitalizations today than COVID is today. Now, I've mentioned that the curveball, of course, is vaccine uptake in our country and in the world and development of variants. And that's just a fact of life. But if things go smoothly post BA2, which we hope they will, I do see a couple of things evolving. Number one, I don't think the teacher as tester will be a model that should be sustained. I don't know any other disease you do a test for in school right now that's laboratory based, that, this is an aberration, if you will. So we either go one way or the other. You become the primary care contact and start doing flu tests and everything else, or more appropriately, I think, you become, using your clinical judgment and your vast experience, the person who lets somebody know you can't be in school today because you have X, Y, or Z, and you need to go seek healthcare at this point. So that's a triage function in a sense, but then also triage functions to me are only a narrow facet, because so much else of what you do is in a continuity matter with kids who don't have necessarily an acute respiratory or GI illness, but have more chronic issues that you're connecting with them far more frequently, whether they be physical, mental, substance related, or what have you. I would hope that those things that I've just mentioned that gave you career gratification can continue to, without the distraction of having one infectious disease be your entire job description and taking it from soup to nuts, from testing and on. Now, one other role that we can discuss, I can tell you there is no decision on state policy on this today, but we'll be discussing it, is your role as a distribution center. And you can tell me the positives and negatives of that, because I think being able to send kits home to families that need them or didn't realize they need them but should have them as part of the strategy may have been a gratifying and positive experience and maybe should stay. But on the other hand, maybe that's also wrapped up in this, we got to get away from COVID business, and why should we be sending kids home? They can be accessed in numerous other locations, healthcare and otherwise, in our communities. So that's something certainly up for discussion with regard to state policy, if you will. But I think the return to things that provide career gratification and satisfy the needs of the student body, the school community, and the greater community is where the future of school nursing needs to be. And my concern, to be absolutely frank, is how much can you put on your plate? Because, when we would go to press conferences back, 4, 5, 6 months ago, and everything we said was the kids are not all right, because we were trying to get people's focus off of preventing the virus and get the focus on how has preventing the virus been the whole cause of why the kids aren't all right now, and the fact that we can't even focus on why they're not all right because we're so preoccupied with the virus. So now that we can move to a phase of not being so preoccupied with the virus, there's so much on the plate, because there is so much physical illness, so much mental illness, so many downstream effects of what the pandemic has produced. We have to have a health community approach to it, but clearly one of the first stops may often be through identification within the school system, the school nurse office, and the amount of communication that then needs to occur with other specialists, with general pediatricians, you name it, maybe at a scale that's much different than it's ever been before. So I just put that on the table. I want to see you have a bright future and have a gratifying future and not an overwhelmed future. I know, just like everyone in primary care and everyone in public health, during the pandemic, people often just threw in the towel and said, I've had it, this is all I can take. I know the majority of your community is still intact, but I know there are some that are not anymore. But the reality is, we don't want the sequela to the pandemic to create the same exact atmosphere and attitude and sense of hopelessness. We need to rally together and constructively work on ways to approach this as a healthcare community and public health community, not as a school nurse here, a school nurse there, or even a school nurse association. It really needs to be much broader than that. So I don't want to end on a negative note because I'm trying to be hopeful as well, but I want to respect the fact that we're about 35 minutes, 40 minutes into this, and I'm hoping you have abundant questions and people who want to interact. And I think we'll probably cover more of what we need to that I may not have mentioned yet through that. So let me turn it over to your leadership, Becca, and I'm sure you've got it figured out as to how we approach the next part of this.
Yes, so we have a couple of questions in the chat, and if you have more questions, please put them in the chat, or feel free to raise your hand and we'll call on you. So the first question, Dr. Levine, is what are you seeing across the state and schools since masks became optional in terms of cases and how things have been affected?
Yeah, so, we get these insights through our EPI team and through people just connecting with me in general, because the whole state feels like they can do that at any time. And the bottom line is, yes, we are seeing clusters of cases in a number of schools, but not all schools. And we're seeing more isolated cases in other settings. I know of one school that Secretary French mentioned at the press conference this week that actually closed because of staffing issues. And I think it was more kitchen staff where they were completely out than the entire school staff, but I don't know that for 100%. And so, yes, I think without masks and with a new wave of more, I don't want to use the word wave, but a new resurgence of a subvariant, we're seeing what you're expecting because the school is a microcosm of the community or a macrocosm of the community. But either way, it's representative of what's happening in the community itself. And I can say personally that I can't even begin to count the number of families that are infected. It's not like just the kid went to school and came home and that was that. It's like everyone in the family was infected, and often the school had nothing to do with it. The kid just got sick later on, and that was that. The cat was out of the bag. So we're seeing a lot of that kind of stuff now, but we don't have as good a handle on everything that's going on in every school. And I don't want to get us into the discussion about the school nurse reporting, which will certainly focus on that. But that is part of why that's so important critically, as long as it is low impact on the reporter.
So one of the topics in the chat is about masking and the fact that we're in an unmasked society at the moment, or an optional masking society. And with a lot of events planned for the spring for parents to come back into the school for concerts and plays and all kinds of events. I think there's a little bit of nervousness about the unmasking and also having the gatherings in the schools. And I think school nurses who are at the table are trying to put the pieces together for administration. But what would you say, what are your thoughts on indoor masking for school events right now, and what advice could you give to school nurses as they approach these conversations with their administrators?
Yeah, so, the thing that I'm most concerned about is the people that we always call more vulnerable. If I were in that group of people who's more vulnerable for whatever reason, could be age, could be illness, whatever, immunocompromised, this is not the time for them to be in large gathering situations indoors, period. And the expectation that everyone in that gathering is going to wear a mask is just not going to happen. Do I feel badly if a school invokes that and says we're going that way? Well, I do think I think it's challenging for them to do that if everything else going on in the community isn't doing that, because then you're sort of almost deluding yourself into thinking that we're protecting people for the 2-hour class play or basketball game or whatever they're gathering for, but then they're going, to whatever, to a restaurant, to dinner in a dining room that's going to have 18 people all around a table in one room, and the windows aren't open yet. So it's not going to change the equation all that much. So I think it would have to be pretty much consistent through society to have that kind of impact. Again, not to say that you shouldn't try what you should try, but I do really feel that people are getting infected and going to get infected, and it's a real challenge to preventing that when you've got a variant that's at least 50% more transmissible than the original Omicron. And now the ones from New York State are another 20% more transmissible above that. So, it's pretty much like in the water.
So the next question is about the state reporting and how most families at home are testing, but they're not self-reporting, they're positive. So there's a bit of increasing questioning about the stats and the case numbers reported and the community prevalence. Do you have any comments about the validity of the numbers or how we can measure if it's going up or down?
Yeah, so, there's been this constant attempt on our part, on the CDC's part, on everybody's part, to sort of say cases aren't the thing that matter anymore. Every state health official has their hands up in the air in terms of knowing what's happening in their state with regard to cases, because the public has done exactly what we asked them to do, which is stop going to our state health facilities to get tested with a PCR test that you won't know the result on for a day or two, and have a test at home you can do and react to immediately. So they've done what we've asked, and that's great. They are increasingly doing what we asked in terms of reporting to us, but we know we have a very small subset of people who've reported. But that number has grown week to week, which is good. But the fact is, I would let people use their personal experience, like I just talked about. Like, I haven't known as many people as I do now who've had an infection recently. That tells me something's going on out there. And whether I think we're at this part of the curve, this part of the curve, or this part of the curve doesn't really matter, because it's going the wrong way. More people are getting infected. And that's what we need to know. And in concert to my answer to the last question about, masking indoors or whatever, even though it sounds like we're a broken record, there's a whole bunch of 5 to 11-year-olds that aren't vaccinated yet. They're sort of in that last cohort of 5 to 11-year-olds where their parents weren't lining up at the beginning. They did their watchful waiting and they're sort of, I'll sit on the fence and see what happens, but they're still not there. And even though, again, serious outcomes is the name of the game, we're not preventing infections with these kids. I would say that the safety factor has been shown, and this is the time to, again, urge them to proceed on and become vaccinated, because the safety and the benefit is so much greater than any risk.
So with the feeling is that antigen tests aren't as reliable with the new variants, and there is also a limited number of LAMP tests, and also the PCR mail-out option is no longer available to schools. What is your recommendation for testing as we move through where we are now and if we see new variants?
So I still think people should have their antigen tests at home. We have yet to see hard scientific data on what many people are telling us, which is their first antigen test is negative or second antigen test is negative, and how well these tests perform against the newest variants. So I would still have people start with the antigen test at home. And I've had lots of people tell me they thought they had COVID and they had a bright orange line on their thing, or red line, depending on what they were using, right away. So we still see that. So don't lose hope in that completely at this time. But if that is true for you, that you're negative on the first or second test and you're committed to the diagnosis, get one of our LAMP tests for sure, because that would be the next wise thing to do. The good news is, if you think about it, you haven't hurt anybody, because if you've done the right thing, you've said, I've still got these symptoms, I'm not going to school, I'm not going to work, or what have you. And you've done the right thing. So it's a matter of just confirming your diagnosis to know for sure how many days you should be out, etc. We have not, as a state, run out of LAMP tests. So though we now may see more of a flurry of people trying to access them because of what I said at the press conferences and at other venues lately, that's still a strategy people should go for, because they take that home and in 30 minutes, they've got an answer on that test as well. And then that could be their sort of final test that they do, because if that's negative, after the 2 antigen tests are negative, you could stop there pretty much. No reason to pursue a COVID diagnosis any longer.
While we're on the testing topic, is there any news if the at-home antigen tests are effective after the expiration date on the box?
They keep prolonging the expiration dates further and further every time we bring it up. So I'm not so worried anymore about expiration dates. But the bottom line is, if we haven't told you that it's safe to use after the expiration date, then it shouldn't be used, because we know which ones now have had an extended shelf life given to them by the FDA, which ones haven't. So make sure people know which one they're using. That's all I could ask.
What would you recommend that we, as school nurses and school people, say to families who are expressing concern with a rise in COVID cases in schools, and they come back and ask us, why aren't you requiring masks? When are you going to require masks? When are you going to close down school? What are some things that, from your point of view, from Secretary French's point of view, are some language that we could say or advise the public?
Right, because what more polarizing issue is there than masks? So I have no doubt that school nurses are being very understanding when some kids do show up with masks. I hope that the other parts of the education community are likewise very open to that and welcoming to that. I hope kids are not bullying one another or what have you, depending on their behaviors, because we really need to reach that level in our society for sure. But I do think that even though there's a cadre of people, and I don't know the size of this cadre, that are very much into, we need to maximally protect everyone all of the time, the public health data would state otherwise, because the public health data does show this decoupling of getting an infection versus having a serious outcome from the infection. And then we're back into the more personal choice arena of what makes person comfortable or not comfortable, how they've assessed their risk tolerance and their own personal risk or their kids' risk. And that's a very different entity. I would have everyone talk about the schools, as I just did, as a part of a greater community where behaviors during the school day can be protective, sure, but if they're not mirrored by behaviors throughout the rest of society, I'm not sure that they have the power to erase what this virus can do, which is easily be transmitted and infect somebody. So we just have to have that reality response part of it. The school can't be an oasis. Just like, Vermont was for the first year truly an island. And that's why we had a travel policy and everything, because we knew beyond our borders, the whole world was very different than within Vermont. But then when the virus pulled its tricks on us and became so transmissible, it was just not stoppable using those kinds of strategies, and we could no longer be an island. And even the islands in the world that are true islands learned that, and they've all gotten infected. So that's sort of the way I would portray things, if you will.
So Dr. Levine, we know that the Head Start programs are still under the federal mandate to wear masks, and I know that the VSSNA Executive Committee had heard that that was being worked on to eliminate that eventually, but what are your thoughts, or do you have any updates to that? It just seems it's very out of place for the kids that are required to wear masks in a school setting where it's an optional masking policy for the state. So do you have any updates on if that will change, or?
I have absolutely no insight into the federal mind on this one. I don't know if Caitlin or Lisa might have any other knowledge that I don't have, but I have heard nothing on that front. And I don't want to force them to chime in if they don't know, fine, because, the federal government is a different creature.
Caitlin?
I don't know about that either at the time. If I do find something out, I'll make sure I send something out. But at this time, I don't know anything.
Thank you.
Do you have any thoughts or opinions on the 5-day isolation? There seems to be a lot of that you're 5 days, you're isolating, but you're still testing positive on antigens at day 6, 7, but you're allowed to come back to work. But infectious disease says day 10 is when you're not contagious anymore. So do you have any thoughts on that?
Yeah, so I addressed this on VPR yesterday too, and it's really challenging. The reality is, I don't want people to keep testing themselves. Once they know they have COVID, they should stop. However, if they're testing themselves beyond day 5 because they really don't feel well, they should use the fact that they really don't feel well determine their return to whatever, as opposed to rely on a test. Because the reality is, we want people who are starting to feel well to be able to get back into society again. And we don't think that their infectious burden of virus is going to be so great that they're going to be harming people. But if they know that their test is positive, or that they have a lingering whatever, or sniffle or what have you, why not wear a mask? People already know that they weren't at work because they had COVID or some respiratory illness, and they'll be appreciated by wearing a mask until day 10 because of the fact that they're trying to help people be protected from them. And that outside chance they had any ability to infect someone else. So I haven't heard a lot from the group, and this might be something that doesn't have to be in the chat, can be just people chiming in about what your future looks like as school nurses and that part of the conversation, and how this transition time, and transition times are the most challenging, is going, because you're still managing COVID to some degree, but you're also returning to the days of old when you're managing a whole potpourri. So I don't want to force the conversation, but I'd love to interact on that one.
Yeah, there were some comments in the chat just thanking you for recognizing how full our plates are, and that you know, there is an increase in what we've been asked to do in our jobs with this, obviously, and it has changed our jobs. But you also pointed out that we're kind of seeing a bit of the days of old, is what you called it, where we're seeing those symptomatic kids that we used to see in our offices. Does anyone want to chime in? You can raise your hand in the chat and we can call on you. Jessica, I see your hand in your video, but I can't see everyone's video. So if you don't know how to raise your hand, down on the bottom of the Zoom bar, there is a raise hand button. Go ahead, Jessica, you can unmute yourself.
Sorry, I was hanging out with the kids for too long. So one thing I'll just comment that it has been difficult for some of our staff during each transition. You know, it's to cope with the changes that are being implemented, because I think naturally the position I'm in, I'm following all of credible news and resources, and not necessarily they are not getting the same information. So that's been I mean, it's all been a challenge, but I feel like I've learned and have grown from it. So I appreciate the challenge, actually. But I know that that's a struggle for our staff, some parents too, I'm sure, but I hear more from a majority of the staff because I'm in the buildings. But they're not having the same information. So they don't understand during the transition the way I'm understanding. So I've just taken time each time to meet with, I'm in a couple of different buildings. And so I take time to meet with these folks after emailing, because not everybody reads their emails, and kind of have a question and answer time to try to help them ease into that transition. And that's been helpful.
Thanks for sharing that. I mean, and so often you have an educator role, and like I do as well. And that can be a very gratifying part of the experience if it's not overwhelming, like everything. And transition times are the toughest.
Well, looking at the time, we are right at 5 o'clock, and I don't see any other hands. So thank you so much, Dr. Levine. This has been really helpful. I think we all appreciate everything that you have done for us and for our whole state during this whole pandemic. And just want to thank you again for always listening to the VSSNA Executive Board and really supporting us through this, at least these past 2 years, but this year especially has been really difficult. So thank you so much for coming and being our guest speaker and for everything you've done for us.
Well, thanks for the invitation. And again, as I've done many times over 2 years, thank you all as well, because you've been an important, critical component of the entire pandemic response. And I hope you hear that enough from the people within the buildings that you're in every day.
Thank you all for coming. And again, this was recorded and will be on our website as soon as we can get it up.
Bye-bye.